Businesses can't run without insurance. You can't fly airplanes or construct buildings if you don't have the protection that's necessary. And that protection goes all the way down to the smallest businesses and the lowest income households. In fact, those households that are most exposed to risks and least able to afford it are the ones who need it the most. The ILO's impact insurance facility has been operating for 9 years now. Initially started with funding from the Gates Foundation and now funded by a variety of different donors. And our aim is to test new approaches, new products, new distribution channels, to learn from the experiences of those operating at the frontier, those that are trying these new approaches, and then to document their experiences, their lessons, their successes, and their failures, and to then promote those lessons and experiences so that others don't have to make the same mistakes or don't have to reinvent the wheel. So we've been operating for 9 years, as I said, and worked with more than 70, 80 organizations that are providing insurance to low-income people, and made significant progress in the amount of people who have better insurance services, not us ourselves, but the partners that we've been working with. But still, there's perhaps as many as 4 billion low-income people who still don't have access to insurance. Right now, we have 11 different innovation partners that we're working with that are testing new approaches. These are projects that are funded by the Financial Sector Deepening for Africa, which is a UK-funded program, and also the French government, AFD. And we're collaborating with them to test new approaches, and some of their experiences already are beginning to bear fruit, and they're covering almost 250,000 people right now. The idea is scale is important. You want to reach a lot of people and serve as many people as possible, but you also need to have quality products. And that's really our agenda, is to promote client-centric products, insurance that really benefits low-income households and small enterprises, not just insurance that's going to benefit the insurance companies. Historically, employees have gotten their benefit packages, their life insurance, their workplace compensation, their health insurance through their employers. But as we're moving toward the gig economy and people becoming more self-employed, they need to have other ways of accessing those types of benefits. And ideally, it would be nice if it was provided directly from governments to the population. That would be the ideal solution. But in many countries, that's not possible. And so we need to see how the insurance industry can enter that conversation, be a part of possible solutions for the changing nature of work. So the Sustainable Development Goals, you find a whole range of opportunities for insurance to contribute to them, whether it's on agriculture, whether it's access to financial services, promoting decent work, you name it. The insurance really fits into probably almost half of the SDGs in a direct or indirect way. And what we're trying to do is really highlight how important insurance is in that conversation, but not just the insurance industry itself, but also how governments can work together with the insurance industry. Insurance that we are involved in is an important complement or supplement to social protection benefits. And so the ILO is actively promoting a social protection floor so that people have very basic benefits, income support, health insurance, health care, and insurance can be an important way of complementing that benefit package so that people who want to can get additional cover. People are receiving regular cash payments, for example. That's great for their regular income support, but then if there's a death in the family or if there's a fire in the household, how do they cope? They don't have extra income that's available to them because they're getting just this basic amount every month. So it's important to see them as complementary pieces, a disaster bit with insurance along with the income support that's provided.